massage therapist here. She's great. This is our rehab room.
Okay.
So we do a lot of exercises and everything in here. Yeah. And this is my room.
Alright.
Yeah, if you want to have a seat.
Okay.
Yeah, it doesn't look as big from the outside.
Yeah.
Come in, it's got a lot more space in here, which is great.
It's a nice office.
Yeah, thanks.
I think I drive by it. My in-laws live near here. And I was like, if you go down Crabapple, you get to like, I'm trying to think of what that intersection is. There's another road that starts with an H. Like if I go that way, and can I get to Old Milton?
Yeah.
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 Live around here somewhere.
Okay, gotcha.
So, yeah.
Nice. How are things? How are, what's new?
I'm like kind of moved out of the yoga world. I mean, I still teach one class a week, but I'm doing something called somatic experiencing.
Yeah.
So it's a lot of nervous system regulation, working with trauma.
Cool.
And I'm also doing some applied neurology, which is really cool. Which
Okay.
I can talk to you about that sometime, but it's fun.
Yeah. No, that'd be
It's
fun.
keeping me busy.
Yeah.
So.
What was the change for?
I got tired of running a yoga studio.
Yeah.
And I'm getting older, and I could feel like I'm not interested in this kind of a practice anymore. Like the movement wasn't working for me anymore, and I was thinking like it's not where I want to go, and there's so much more out there. So
Yeah, I remember doing teacher training, and like before I was like, I want to learn how to structure a class and do that, and then afterwards it was like the mental side and like that was way more interesting. So
that's more what I do now, is like more the philosophy behind it with my clients. So
That's
I
cool.
rarely do any yoga anymore. But
yeah, that's all right.
Yeah.
Okay, how's the body feeling?
So I started lifting, and I feel a lot better usually.
Good.
I have scoliosis. I didn't put any of this down in that form.
Okay.
So I have scoliosis. I've always had a little trouble with my hip. Like my SI joint would get a little cranky, and then it's usually my left hip. And probably the last few months, this hip has been like, it doesn't bother me when I'm doing anything. It bothers me when I'm not doing things. Like when I sit, when I lie down, when I'm still. And then I have some stuff in my shoulder too, but I couldn't tell you, like, the only time I notice it is when I'm driving.
With the shoulder. Okay.
So the hip though, it's like if I stand up now, like if I've been sitting for a while, it's sometimes external rotation. I know that's limited. My internal rotation's, I think, okay. But yeah, so if I sat here for an hour, I would get up and it would be like I'd have to walk a few steps before it kind of eased up.
Is that like hip here or hip?
I feel it more, trying to think. So if I'm sitting like this, I do feel it down here, but I also feel it in the joint.
Okay.
So,
Gotcha. What have you tried for it?
Usually when I do my applied neurology stuff, but usually when I do internal rotation, it tends to calm down a little bit. Like if I do some, like I'll lie on the floor, internally rotate, slowly lift, and it'll ease up some.
Okay.
So as release sometimes helps, but it doesn't feel like a psoas muscle issue, which I tend to be cranky on both sides.
Okay. What type of lifts are you doing right now?
I'm just following a program. I don't really know anything about, like if you put a weight in my hand, it's like I don't know anything about the body. So,
It's okay.
but I do, the things that I've found bother it are more, nothing while I'm doing it, but squats are hard. And deadlifts, I have a hard time not going into my back. So.
Yeah, that's what I was thinking.
But nothing hurts while I'm doing it. Like it actually feels better when I do stuff like that.
Good.
But then down, like after I rest a few hours later, then it's achy.
Is it so the deadlifting and squatting, are you doing that like barbell? Or
I usually use the Smith machine just for the stability. Or I do some deadlift with barbells, but it's pretty lightweight. I'm not deadlifting a lot, like maybe tops 80.
Okay.
So.
Do you have a hard time getting into the glute?
Yes,
Yeah.
always.
Always. On that left side more than the right?
Left side more than the right.
Okay. Do you ever do any single leg stuff like that?
Yes, and those are very hard for me.
How so?
So balancing, if I'm balancing on my left side, it's really hard to keep my knees steady. And right side, I don't know, this one feels hard, but the left side's definitely harder. And if this helps, my pelvis is like this. This is a little bit posterior, this is a little interior.
Sure. Okay, yeah, that helps. Okay. What else with that?
It bugs my knee. Like, I know it's coming from the hip. So I usually stay away from like I don't do really deep squats. I don't do a lot of lunges because I feel unstable. So.
Where do you feel it?
Trying to think, like if I do a single, right under the kneecap, more pretty centered, but towards the top a little bit.
Yeah. Okay.
And you can see it, like you see, like I'm wobbling when I go, like my knee wants to go in, and I can feel that in my foot.
Okay.
I'm giving you so much stuff.
No, this is good. Yeah, this is great. How about lower back? How's the lower back feel? What do we call that?
I have less low back problems than I used to. The only thing, my psoas muscle will spasm periodically, and when that happens, like I don't even know how to explain it. It's definitely low back, but it's more muscular. It doesn't feel spinal.
Okay.
So when that happens, I usually try to stay away from anything where I'm like hip hinges, because it tends to irritate it more.
Okay. With this new program, are you doing any like strength through rotation or anti-rotation?
No, but I do a lot of that on my own, but not strengthening, more just mobilizing. So that's probably a bit of it.
Okay, gotcha.
If that's what you're thinking.
that plays a huge role. That in locking into core, especially through rotation or anti-rotation, will allow us to access the hip and glute a little bit better. So we'll see if we can get into it. Also, I can see that every time you stand on your left foot, you actually shift all your weight to the outside. So you're actually not getting into big toe, which will cause that instability of the leg. So whenever you stand on that leg, your brain essentially feels like this unsteadiness from the foot, so it's gonna have a really hard time locking into that hip.
And that's what it feels like.
Yeah.
I also have there's something weird with this foot. I'll show you without my sandals on.
Sure.
It's been like this all my life, but you see, like I've got this bone, like that has always been there, and I don't have it on the other side. And my dad and my brother have it as well.
Just on one side?
I think they both have. It's bigger on one side, but mine, like, this has started to get a little bit worse, but that was there when I was a kid.
Okay.
Like I didn't injure it or anything.
It feels like bone? Yeah.
It's almost like there's an extra bone there.
Looks like bone. Okay. It might be insignificant. It may or may not be, we'll check it out.
Okay.
Sometimes it's like we just have asymmetries. And you can leave those off.
Okay.
We'll do the assessment with them off.
Okay.
And then the scoliosis isn't like something you've always had?
They didn't find it until I was 27. So I don't know, they screen you at school, no one caught it. So I found out when I was 27, and it's pretty slight, but I haven't had an x-ray in years. I don't go to anybody.
Sure.
And it's to the right. So this is my concave side.
Okay.
Wait, I always get it mixed up. Yeah, this is.
Okay.
So I'm like this.
Gotcha. Okay. Scoliosis is one of like my least favorite things that doctors say, because it's most of the time like it's inconsequential, like it doesn't matter. Like if you're in pain and you go to get an x-ray, you'll be standing a little bit different, right?
Yeah.
So if I'm here and I'm in pain and I shift my weight this way, like you can barely see me move, but then they take that x-ray
And it's gonna.
and it looks like I have a curve, right? And then they hear, right, like scoliosis or osteoarthritis or things like that, and then people will like be like, oh no, I've got scoliosis, like it's a thing. And all it means is there was a little bit of a lateral curvature whenever they took that one picture during that one, half a second of time. So most scoliosis, especially if it's slight, like I wouldn't even think about it.
That's why I stopped addressing it, because it felt worse. Yeah. So I was just like, I can just strengthen.
Yeah. That's, I mean, the best thing is just get strong so the muscles support the body. There are occasionally like a structural scoliosis where like somebody was, as they were a kid, half of their vertebra didn't form.
Mm-hmm.
And so the vertebra is literally shaped like this instead of like this. Those are the kids who like, okay, well now that's like an actual thing. But 95+% of the time, it's like just, I was in pain, I was standing like this, or I had some muscles that were pulling on this side, and then it's like, so anyway, I digress. Okay, how often are you lifting during the week?
I do like 5 days a week.
Okay, good for you.
Yeah.
You're using Smith machine for lower. Okay, cool. What questions do you have?
I don't really have any. I'm
Okay.
just excited.
Yeah, okay, cool. So what we'll do is we're gonna go through a movement assessment.
Okay.
I'm gonna check kind of everything head to toe. If anything is like tight, weird, painful, if you have questions, please ask.
I will.
And I'm gonna be like a broken record as I find different things. I'm just gonna keep on saying it so it all sinks in.
Perfect. I love that.
Cool?
Yes.
All right, so if you're ready, let's get started. I'm gonna stand right over here. And then, what's his name?
Taylor.
Taylor. I remember meeting him. He was great.
He's okay.
Yeah, because that's right. When I was going through that was right whenever I tore my pec.
Oh yeah, we ran into y'all at the grocery store.
Mm-hmm. Yeah, you guys
I
saw me
remember
like
that. You were like on stuff.
literally. Yeah, it was like I just got out of surgery. Okay, so face, feet
together.
teeth together. I want you to look up to the ceiling. Okay, back down. Look down to the floor. Go back to neutral. Look over this shoulder. Good. And over the other. Good. How do those feel?
Pretty good.
Okay.
Oh, I have some crunching in my neck when I turn my neck, but I I fell on my head when I was like 8, and I've got some narrowing between C6 and 7.
Okay.
So, but it's.
Is it always crunchy or just,
I just,
some of the time?
I can hear it, but it doesn't hurt.
Okay.
It's just like some of the time. I would say some of the time.
Do you feel like you always like want to pop your neck?
Sometimes.
Okay.
I don't do it. It doesn't happen a lot, but like sometimes I'll get like this sensation needs to pop.
Okay. Gotcha. Let's turn to face the window.
Okay.
I want you to reach this arm up towards the ceiling and try and touch back here. Great. Good. Switch sides.
Same thing.
Yeah.
Here's in the way.
Okay. Look at my pocket knife. Take care of that. Okay. Switch sides. So not this, behind lower back. Try and touch here.
Where?
Right here. Great. Pretty good. Switch sides. Try and touch here. Yeah, so you have a little bit of shoulder blade winging on this side. Okay.
It's a lot better.
What do you do for it?
Since I started strength training.
It's good. Are you doing a lot of pulling?
Yes.
Great. Upper traps feel pretty good. This one's pretty tight though.
Mm-hmm.
Do you have a harder time engaging this lat?
Yeah.
Okay. Turn back to face me. So, the interesting thing with shoulder blade winging, we're looking at your spine or your back. This is spine, this is rib cage, and this is shoulder blade. All right, whenever that winging happens, we're getting shoulder blades peeling away here, which creates that instability. Most want to immediately think, let's get shoulder blade into here, which is correct. The other piece of the puzzle is actually getting the ribs to expand backwards to meet here, and then building that strength so that this is super connected. So your right side was winging a little bit. I think that's from just some muscle tightness in the front. Left side was stable, but I can see and kind of feel the shoulder blades getting pulled up and not locked into this, but it's just getting peeled up this way. A lot of that comes from upper trap tightness and not being able to engage some of the deeper muscles into the shoulder blade. So you've got to spend some time here to be able to learn to lock that in place. Common with a couple things I was watching whenever we were sitting talking before, you internally rotate a lot, bias this a lot, versus being able to set into that position.
Yeah.
That over internal rotation through not only just the shoulder, but the whole scapula that attaches to the rib cage can really overstretch this lat and make it hard for us to engage.
And would there be an effect, like one of my ribs, and I never remember, comes out? Yeah.
So yeah, and we're gonna check that. Essentially, when we have that, rib cage is probably rotated slightly to one side, which is probably why the left side has symptoms, even though this is connecting.
Yeah.
The right side's winging, but we'll check into that.
Perfect.
Yeah. So if we think about it, right, the shoulder is, its foundation is the shoulder blade. The shoulder blade sits on a rib cage. The rib cage is controlled by deep core in here.
Yeah.
So deep core is our breathing pattern. It is how we transfer force from lower body to upper body. Anti-rotation and rotation exercises are really important for that. So.
And I need more of that.
Yeah, that's okay. So let's go feet together, legs straight. Chin touch your toes. Great. No. Good, come on back up. Let's go feet a little bit wider. And come towards me just a step. Perfect. Hands like a Y. Just lean back as far as you can, no falling. Good, and back up. How do we feel with that?
Pretty good.
Okay. And then from here, we're gonna rotate to one side, just as far as you can. Good, other side. Good. Was one side harder than the other?
Left.
Rotating to the left was. Okay. Okay. Now, feet. Yeah, right about there. Hands like a Y. Just squat.
All the way down. Go down and up.
As low as you can.
Ooh.
Okay, there you go.
See, that's gotten worse in the last couple of years.
Your squat.
I used to be able to just go down and hang out. So that's one thing I've noticed is like I lose balance.
Yeah, I want you to do that again, but I want you to pay attention to squatting into this part of your foot.
Okay.
Here.
So push down through the inner. Okay. Arms up. That's better.
Okay. Yeah.
And then come back up.
Yeah. So.
Hear my knees.
This one's louder, isn't it? Yeah. A big part of this, you're shifting all of your weight outside, and your big toe basically wasn't on the ground as you were squatting. That what will happen there? So like, if we're looking at this leg, if my big toe isn't engaging, the arch will drop. Even though you don't have like a collapsed arch, what you're doing, and a lot of people do this, is that they just shift all their weight to the outside of the foot. So I technically still have a high arch, but there's nothing going on here. And so whenever I go to step, all of my weight, it's always to the outside.
That makes sense, actually.
This loads through the lateral part of the leg and creates a lot of like IT band tightness. Over time, so what that noise is the kneecap is getting pulled this way.
Yeah.
So kneecap, I kind of think of it sits in like this little groove. It should stay here. Whenever we get an overloading on one side of the leg, 99% of the time it's the outside, kneecap gets pulled here, and then that grinding is the facet joints grinding together.
And mine does that. Like, I can see it.
You can see the kneecap?
Yeah.
Yeah. You can so most of the time, like, the noise is something that people like, oh, like, my kind of joke around, my knees are making noise or whatever. Over time, this really wears out the joint and causes, usually eventually towards like a knee replacement.
I'd like to avoid that.
Yeah, so, I mean, me too, it's not fun. And people think of it that like, you know, it's not just the replacement, right? It's all of the pain and things that you suffer in between until it finally gets bad enough, like, okay, let's replace it. You can take this and pull it back to a centered position and actually get knee gliding. The noise goes away, which is nice because it just tells you that the facet joints aren't rubbing together. We do that by learning to load through here more and get this guy
Yeah, I can feel that when
active.
but I have to roll up my other side to do it. But I can feel that part of my thigh.
Feel it engage and you push down? Good. Yeah, so there's the 3 arches in the foot. Heel, or sorry, big toe, little toe, heel. You're just overloading this side and not getting into here. So we should be able to have that tripod down and this lifted. And then, yeah, be able to push through the ball of the foot and not have the toes scrunch. There you go. That even looks better like that. So, and there's a whole series of exercises to like build up that strength. So, let's stand on one foot. Yeah. It's okay. Switch sides. Yeah, much stronger on this side. Okay. Okay, and now we're gonna do a mini squat. Tap that one foot in front of the other.
See, I avoid these like anything, but that I mean, if I think about that, it doesn't feel like my knee's gonna pop as much, but it still feel it.
Yeah.
And this one's doing it too a little bit.
Yeah, so like the right one's more stable through the whole foot, but it's still a little bit asymmetry. The left side, it's almost like you have 2 parts of the foot where like this is doing all the work and we're totally disconnected from here. Whereas this, the whole thing is connected, but it's just getting pulled up kind of like that.
Okay.
So,
and I have sprained this ankle a lot over the years, and there is some, I think I have some, I've never been diagnosed, but I have some hypermobility stuff.
Yeah.
So, and that's, I think it's in my ankle joint. You can't see it now because I'm old, but it's, like I used to be able to move my joints a lot more than I can now.
Okay.
To like, I was never flexible. It was all joint stuff.
Gotcha. Yeah. Yeah, I personally, like, I have a foot and ankle day at the gym. Springy, doing things where we're generating lateral control and springiness for the foot. It's been like one of my absolute favorite things to do. Because especially, both of my ankles have been absolutely torched from years of martial arts. This one specifically is just put in submissions and been ripped apart. So it's missing a lot of ligaments. But whenever we have that injury to the foot, it immediately downregulates the proprioception of the ankle. Some muscles are gonna turn off, others are gonna tighten up. And so you have to spend time with longer form isometrics to actually build up the strength and stability and kind of rewire that proprioception.
Okay.
So,
I need to do that.
yeah, there's some, like, let me get into them today. Okay, so we're gonna go onto the table here. We're gonna go knees and elbows together, hand on lower back, just twist towards the ceiling.
Okay. Can I put my glasses here?
Yeah, that's fine.
They'll fall off. So knees and elbows together.
Yeah, I think child's pose, and then one hand on the lower back. Good, and twist towards the ceiling. Yeah, great. Switch sides. Aha, that was the tough side.
Yeah.
Yeah, okay. So rib cage might be rotated a little to the left, and we're gonna go, oh, you're fine. We can go hands and knees on the table, like a tabletop.
Okay.
Okay, perfect. I want you to rock forward. Okay, and back. Back to neutral. Is that your hip though?
Mm-hmm.
The left one?
Mm-hmm.
Okay. Rock towards me. And left. Okay, back to neutral. Brace your core. Okay. We're gonna go face down. Head here, there's a little hidden handle for you right there. I'm just gonna check some hip range of motion. Do you feel like it's hard to engage your core?
Depends on what I'm doing.
Okay.
That's a big answer, I know.
It's okay. If I push this way, how does that feel in your lower back?
There was like a little twinge of pain, like right here, but like 1 out of 10.
Okay. Did it feel like it released any pressure from the lower back or just me pushing on it?
Can you do it again?
Sure.
Not really.
Okay. Let's just check some. Okay.
So ask.
Yeah, you're actually missing a good bit of internal rotation on this side. So 0, 5, 10, 15, maybe 20, 25 degrees. We should be about 45.
Okay.
How often does psoas give you an issue?
A lot less since I don't practice yoga as much.
Okay.
But I need to pay attention, but maybe 4 or 5 times a year.
And what does it do whenever it?
Like, last couple years, it's been like I can barely, like it's just incredibly painful. Right? It's hard to sit, it's hard to stand. Doesn't really feel better when I'm lying down. It just feels like it's constantly spasming. And it switches sides.
Okay. Do you have any idea why it does that?
I honestly think it's a little bit hormonal.
Okay.
But no, because
Okay.
it doesn't seem to be associated to anything I'm doing.
Yeah.
It happens when I get stressed.
Okay.
That I do notice that.
Let's cue this. I'm going to check some stability systems
Okay.
in and around the lower back and hips. So I want you to lift this leg up as high as you can. Okay, back down. Feel how that all came right here. Okay. Bring left hand by left hip. Good. We're going to lift it up off the table. Good. Hold right there. I'm going to push down. Don't let me. Hold, hold, hold. Good. And lift that leg again. Okay, back down. Is that same? Harder or easier?
Easier.
Easier? Okay. We have these slings of connective tissue. Posterior oblique sling is one important one. Connects glute to opposite lat and provides a lot of stability through here. Your leg went a lot higher and I didn't see lower back take over as much.
I didn't feel it either.
Good. So let's check this side by itself. Yeah, so again, same. This hand up the same way. Great. I'm gonna push down, hold. There you go. And lift that left leg again. Way better. Okay.
I didn't feel that on this side. On that one.
Okay. Gotcha. Let's try and go face up.
Okay. Head in the same spot?
Yeah.
I never introduced myself, I just realized that.
Neither did I.
Me too.
Likewise.
Poke around the ribs here.
You see what I'm talking about?
Mm-hmm. Yeah.
So the first time, I know you don't like scoliosis, but the first time I went, they told me my spine was a little twisted.
Mm-hmm.
Right around there.
Yeah. So, brace your core again. Yeah, okay. Keep both legs straight. I want you to, toes to nose, lift this leg up as high as you can. Great, no problem. Back down.
Keep it up, okay.
We're gonna cross your arms, do a mini sit up and bring that shoulder towards me. Right there, perfect, hold, and lift this leg again. Good, and back down. Same, harder, easier?
Same.
Same, okay. This leg by itself. Yeah, great. And then this shoulder, that will hold. Good. It's okay. Good. Same, harder, easier?
Same, but it wasn't harder, but I feel it more in the hip flexor
Okay.
than the abdominals.
Gotcha. Okay. Makes sense from what you're having with the psoas that keeps coming up. A big part of that is you're actually not bracing your core right.
Mm-hmm.
You're using superficial movement muscles to try to brace versus deep stability muscles to try and brace.
Does not surprise me.
So it's pretty common, and whenever we don't use that deeper stability muscle to brace, your brain has to pull from other muscles.
Mm-hmm.
Psoas is a big one. So then psoas will be doing double time, and it's because deep core isn't doing its job. When deep core does its job, the muscles that attach to it from the hip are able to do to work. And again, if in times of like stress, or it could be hormones, or it could be like an intense workout or something, those muscles that we're compensating with, like psoas, sometimes it's QL, will
Backs up too.
yeah, so those are two common ones for here. They're essentially doing all the work all the time, and then like high stress happens, and then they're like done.
Yeah.
Lock up on you. It's either high stress or like it's the other one that here is like first thing in the morning. Someone bends down to tie their shoes, comes up, and throws out the lower back.
Yeah.
So like I keep pushing into here and asking you to brace your core, and you're using the abs really well, but you're not using the breath the right way. Right, so if you push into me right here.
Right there?
Yeah, so if we push in here and I brace with the wrong muscles, right? I'll try not to demonize movements.
I get it there.
It's
the less efficient workers.
Yeah, exactly. So if I brace here
Yeah.
versus brace
Oh yeah, that's a big difference.
So
you're using your breath with that?
Mm-hmm.
Yes, I need to work with that.
This is what we'll go through today. I'll show you how to do this.
Okay.
This mechanism should be happening all day. Takes a while to rewire and change, but once this movement pattern changes, this all day is expanding, compressing, and it maintains this pressure.
Okay.
If I lose it,
yeah,
now I'm here. I'm still sitting upright, but other muscles are like, oh shit, like I gotta work now.
Yeah.
QL's gotta take over to stabilize spine. My psoas has to transfer force from upper to lower body now, and so those guys have to do the work versus here.
That makes a ton of sense.
with lifting, you have to have this in order to use your hips, the glutes the right way, or else the lower back is going to take over.
And I'm not doing this.
Yeah. So
that makes a lot of sense.
The other thing that'll happen is how the ribs are like kind of popping out here and flaring. Ribs should be kind of pulling down into this position and then be able to breathe and expand. So you can bend your knees and put feet on the table. Let's get right into a breathing drill.
Okay.
So when you think of deep core, think of diaphragm on top, deepest layer, transverse abdominis that comes around, and pelvic floor on the bottom. We want that to be a pressurized, think can of Coke, where top and bottom, as I breathe in,
they move together.
They move together, and at the same time, core expands in 4 directions. And as I exhale, diaphragm and pelvic floor lift, and core compresses down. What we're going to try and do is we're going to overactivate that now,
okay,
so that we can underactivate it throughout the day. So I want you to push into me again.
Okay.
I'm going to go right here. So if you can feel where the ribs are,
yeah,
it tells me I'm not using my core.
okay,
So I'm going to breathe in, and I'm going to cough. And as I cough, you're going to feel those ribs go away,
okay,
and you're going to feel my core pressurize and push out.
okay,
And I'm just going to maintain that pressure I created and breathe in. Let it all expand. And as I exhale, this is going to be the hard part, is letting it drop. If I lose it, ribs come back.
okay,
Or if I exhale and use the abs, the movement muscles,
it goes in.
ribs come back.
So do you do, like, the more you do this, are you aware of this?
What do you mean?
Like, are you just doing this all day without being aware? Okay.
Yeah, it eventually turns into new normal.
How long did that take?
It's more how many. Sometimes it takes a month or 2.
Okay.
Yeah, but it's definitely possible. I have a lot of patients we work with, and one thing, the ribs will flare back down. 2, whenever you get into lifting, you'll actually be able to engage right muscles.
Okay.
Because your brain, like, this is the center point that transfers force from lower to upper body. When it is not connecting well at that deep stability, it's gonna pull from other places to compensate. So with you doing more lifting now, like, this is paramount.
Yeah.
And then you have to just match the intensity to whatever exercise you're doing. So like just sitting here, like I'm still engaged and I'm still pressurized, but maybe 10%.
Okay.
If I am throwing a ball as far as I can, or pulling a deadlift from the ground, this is, 90% pressurized.
Okay.
So it has to be able to fluctuate to whatever we're doing throughout the day. But also, if I stand up out of this chair, I need to be braced to stand up. That allows me to then use the deep muscles of the hip. If I'm sitting down or getting out of a car, reaching to move this, I need to be engaged here the right way. I can still accomplish the task by bracing backwards, but then as soon as I do this, I can feel lower back starting to tighten up. So, okay. So again, I want you to keep hands here so you can kind of feel good. And so what we're gonna do is you're gonna breathe in, try and push, just nice easy expansion. And then you're gonna cough. Good. Feel how that pressurized here? Now as you breathe in, try and push all of this out. As you exhale, try and squeeze it down together. Good. Breathe in, push this out. It's okay. Good.
That's hard.
Yeah, you're doing good. Yeah, great. And so when you watch babies breathe, this is exactly how they breathe. The belly and chest, everything rises together, expands, and then drops.
I can feel this in my back body better too.
Mm-hmm.
Because that's hard for me. Like I know I'm supposed to be doing it, but I can feel it now.
Good. Yeah, as you breathe in, you'll get this expansion back here. Good.
Am I keeping it?
Mm-hmm. Well, you'll get expansion and compression through here. So this naturally decompresses spine too. Yeah, there you go. That's great. Mm-hmm. So let's go back to a brace. So now your brace is going to be like the cough, but you're just not going to exhale. So it's going to be a breathe in and then push out. Yeah, good.
And then breathe.
Now let's try and keep that and breathe. Yeah. Expand, compress. Yeah, really good. So that little bit of shaking there is excellent because that's just these muscle fibers waking up. Good. Yeah, that's great. Take a break.
That's really helpful because that's kind of backwards from what, like I've had to do positional, like move my body in order to find that back breathing. And like that was, I could feel it.
Yeah.
So that's cool.
Yeah, that's great. And what you'll find too is this will start to normalize rib cage.
Oh, that's nice.
Because, right, all of these muscles attach onto the rib cage and then it teaches us how to actually like mobilize all this tissue. Okay, that's pretty good. So we're gonna try glute bridge. But how we're gonna do this is you're going to brace your core and you're gonna maintain that like cough. So you're not gonna breathe, so like that.
And hold my breath.
Hold your breath as we lift up.
Okay.
And then once we're up, we're gonna try and hold that for 30 seconds, but we're gonna breathe.
Okay.
Just the same way. Okay? And then as you're doing this too, we're just gonna pay attention to these guys.
Okay.
Cool. So let's first do breathe in.
Can't find it.
It's okay. There you go, that's fine. The laughing or the cough is similar. So maintain that pressure.
Okay.
Push the feet down and lift. Good. Doesn't have to be super high right there is great. Good. So now we're just gonna hold this for about 30 seconds as we breathe in and out. Really maintain pressure. Big toe.
About that.
It's okay. Imagine like you have a ball between your knees and you're just barely holding it. Pinch it. Just, yeah, there you go. Find the inside edge here. Good. Good. Keep this breathing, keep this braced.
Yeah, I feel my glutes a lot more.
Yeah, because they're attaching onto a stable foundation so they can actually fire. It's okay, you got it, keep going. Yeah, give me like 5 more seconds. That shaking is great. Some motor units getting online. So now we're gonna brace again. Hold your breath on that brace and then lower back down.
Yeah. That was very different. That's wild. I know I have some breathing patterns that need addressed, like, and I've been trying to find it, but like that's very different.
Yeah, you're as soon and whenever I had you tabletop and you were shifting, there was a lot of like aberrant motion through core, and that's why I had you brace there. And I could feel right off the bat, like we weren't getting any deep brace, it was all superficial.
Yeah.
What happens is this turns into your new pattern. And basically all day, I call it the poke test. Meaning like if I was looking out this window and you were to surprise poke me, it should hit a little bit of a wall.
Okay.
If I am not using my core, it'll kind of like give me that like visceral response. So, good. Let's do one more round of that glute bridge.
Okay. It is very hard to find.
So the cough really helps.
I think I got it.
Okay. Yeah, that's great.
Okay. And then breathe in, hold and lift.
Yeah, so we're gonna hold our breath on the movement right now, just so our brain doesn't have to do too much. Yeah, there you go. Good. Good. And so the reason we do glute bridges is not to get better at glute bridges. It's actually a really good progression to a deadlift. More core here. Good. Push my thumb out. Yeah. Super strong. Expand. Compress. Just maintain that pressure. Good. More. Yeah, that's it right there. That's great.
God, that's hard.
5 more seconds. And then we're gonna check back in, foot, knee, good. And then re-brace and come all back down.
Yeah, that feels just completely different in my back.
What's the difference?
I just always feel wobbly in my like SI low back area when I'm coming in and out of a spinal extension. And it doesn't feel like that.
Great. Yeah. Yeah, we're getting that deeper stability locked in. The other thing, really helpful, is everything up here. Right. So you don't do it so much. I have a lot of patients who they're breathing here all day. You're aware of breathing patterns, so you're not, but refocusing this will allow these to drop even more because they're not, for most, they're using them all day. It's not really you, but if rib cage is getting flared out here, we have a lot of compression in the front, which will lead to tightness above it. So actually this breathing drill will take ribs and pull them down. That allows us to open through here and connect shoulder blade. So we're gonna try one more. The same exact breathing drill, but we're gonna do a dead bug.
A what?
Dead bug.
Oh, hands and legs in the air?
Yeah, so I'll leave them a little on the ground to get this. You can do it on the table, but I'm gonna be here. Again, ribs going away, pressurized all through here. I'm gonna lift one leg, then the other, and then my arms. I like to imagine like I'm scooping like a big ball together with my elbows. That's gonna help me get into some of the shoulder blade. And we're just gonna try and maintain this position. So we breathe in and out. My back, super flat. And as I breathe in, I actually get expansion into lower back. And we're just gonna try and hold this for about 30 seconds.
Okay. I'm laughing because I already know.
It's gonna be tough.
It's gonna be tough. Okay, so.
We're always bracing before movement. Think of your cough. And that even helps too, just a little. Good, that's it right there.
Okay.
Now, both legs are gonna come up one at a time. Knee above hip, foot above. Yeah, I like the integration of the foot. Arms reach towards the ceiling, and imagine like you're pinching my hands together. Just
Okay.
A little bit more. Yeah, there we go. Good. Yeah, really good.
That's actually not as hard as I thought it would be.
Yeah, great. On your inhale, try and get it back here into my hand. Yeah, there you go. That's it. So can we maintain this? Keep this angle of the knee and tap this heel. Good. And switch. There we go. Good. Keep going. Taps. Another 5 to 10 seconds. Great exhalations. Keeping these down. 5, 4, 3, 2. Good. Take a break. That was pretty good.
That felt better too, because those kind of things tend to get in my hip flexors. So, and I did not feel that at all.
Perfect. Yeah, and that's really common that hip flexor has to do the work of deep core when
Mm-hmm.
deep core is not doing the job. And so that's when I was talking about like times of stress, whatever the stressor is, like you know, life, hormones, exercise, then those.
Carrying my 60-pound dog up and down the stairs.
Oh yeah, I forgot I didn't ask you how that's going.
Oh, it's God. We got 11 more weeks, and
Mhm.
she's heavy.
Yeah.
So.
Well, bracing is definitely gonna help
Okay, I'm gonna do that.
that. Cool. So let's brace. Let's come up to sitting.
Okay.
And then, so I'm gonna just show you a nice little trick here. So I'm gonna have you just sitting nice and normal. I want you to brace by like belly button to spine, or like
Have to.
sucking in, or you know, just how you were doing it before.
I don't usually do belly button to spine.
That's good.
Okay. So what was it? I don't really know what I was doing before.
Actually, just go so I want you to just do a regular brace. Just do, yeah, so that's improper.
Okay.
I'm gonna push this way.
Oh yeah.
Okay. So QL had to take over a lot there. Now I want you to do that cough and push my hands out. Good. Keep that.
Mhm.
See how much better?
It's a little easier, yeah.
Okay, let's go next door. I'm gonna give you a foot exercise too.
Okay.
So. Okay, so this is one of my favorite starting exercises with people. We do, it's called a kettlebell pass. So, through arches of the foot, we're really gonna focus on getting this guy down. How we're gonna do that is in this like, heel elevated kind of lunge position. So I'm gonna be, my feet are sweaty. I'm gonna be lifting toes,
Okay.
lifting heel, and then placing toes down. So I'm just barely hovering this heel. My hips are square, and then I'm gonna take a little bit of a bow. So we might start in more of like a 50-50 split position,
Okay.
and then I'm gonna start adding eventually more and more weight until we're all of our weight here. What we're doing on this first rep is just finding equal pressure through the whole ball of the foot.
Okay.
That way I'm not just shifting my weight out, it's gonna force us down here. Hips are square, and I'm just leaning over it. So first set, we're just gonna try and find this position for about 30 seconds. Core is
Braced.
braced. And then the kettlebell pass is taking kettlebell, passing from side to side.
Okay.
It eventually gets quicker, and we get more weight on the front leg. So what's actually happening is there's gonna be a lot of stability that's gonna wake up in the ankle.
Okay. Do you want me to start with my left foot?
Yeah, we'll do left foot.
Okay.
Cool.
So is that far enough forward?
Looks great.
Okay, so.
So I like, yeah, lift toes, then lift heel. That just forces us into the ball of the foot. Then you can place the toes back down. Good. Try and lift that back heel. And just load as much weight into the front leg as you can. Perfect. And we're gonna try and start to make this connection between arch and like high hamstring. Good. Keep that breathing brace. You can always check with the poke. It's gonna be a little bit harder in this position. Yeah. And we're just trying to get that equal weight across here.
It's hard.
Yeah. Good. Yeah, this is one that really is challenging, and it makes a huge difference in activating right here. 5, 4, 3, 2. Good.
Does it matter that I'm gripping my toes like that?
As long as the toes are secondary to it,
Okay.
and we're putting most of the weight through the ball of the foot versus the toes.
Okay.
I kind of think of the foot as like two different muscle groups: muscles of the arch, and then muscles of the toes.
Yeah.
When arch doesn't do its job, toes will overcompensate and try and grip floor.
Okay.
So let's try the right leg.
All right. So toes up.
Yeah, and that's why I like toes up first.
Heel up. Toes down.
Mm-hmm.
And then.
Uh-huh. And then we're just leaning in as much vertical on the leg. I'm taking this a little bit square, a little bit of a bow towards me with the hip. Yeah, good. So we're trying to make strong connection here to the high hamstring.
That's not nearly as hard on this side.
Yeah. Really good. Breathe and brace. That's a perfect way to check in on that. Good. Good. 5. Do you feel that connection between here and here?
A little bit, yeah.
Okay.
More on the other side.
Gotcha.
But I also tore that hamstring.
This hamstring?
I keep telling you stuff.
Okay, switch sides. You tore the muscle belly of it?
I think I did something to the attachment. I didn't have that confirmed, but I heard somebody was adjusting me in a yoga class and I heard a pop.
Ooh.
Yeah, and it took about a year to settle down, so I'm pretty sure it was.
Oh, okay. Yeah. That makes a huge difference.
Mm. Okay. Sorry.
It's okay.
I forget about that.
No, it's okay. This is going to be a really good exercise for you then.
Oh, perfect.
Because the angle of the hip, we're actually going to get more of a high hamstring.
Okay.
And then spending a lot of time in this isometric it's really good for tendons. So, okay, so we're going to step back into this other position. Great.
The distance, okay?
Yeah, that's fine. There, good. Heels just barely off the ground. Yeah, there you go. That's your square.
That.
Great. You're gonna go slow passes with this, especially from outside to in. If we need
From
to,
outside to in, but this way? This way?
That way's gonna be easier. This way's gonna be more
Oh
challenging.
my god. I can barely do that.
Mm-hmm. Good.
That's crazy.
Yeah, this. It's okay. Keep your core braced. Keep trying to hinge in. Find that high hamstring working.
Oh.
It's okay.
I'm gonna do that again. That's really eye-opening.
Mm-hmm. This is when I demo this, you're like, oh, not that hard. But when I have people do it, they're like, what is this? Great. And so we're getting, yeah, there you go. Yeah, great. So we're getting all of this lateral control, and we're getting that proprioception working.
I feel that in my high hamstring.
Perfect.
A lot. Like in a good way though.
Yeah. 5, 4, 3, 2.
And my calf.
Yeah. Good. Let's do one on the right, and then we'll try walking and
Okay.
see how it feels. Great. Good. Shift weight onto that leg. Again, we're just going as much weight onto the front leg as you can while being able to complete the movement.
Okay. And then do that.
Mm-hmm. Yeah, way more stable.
Yeah.
See how
I'm rolling, but
it all moves together.
yeah.
Yeah. So not being able to connect to a foot will not allow us to lock into the hip. Because the hip, the foot controls what happens to the leg above it. And if it's not doing its job, you can't really expect the one sitting on top of it to do its job. Good. 3, 2, 1. Okay. Cool.
And felt that more.
Oh yeah.
Yeah.
Good. Try walking around a little bit. See how that feels.
I didn't realize that was squishy. Yeah, I feel. Ooh. I also have ADHD. I feel it here in my hip.
Like it's stretching?
It just feels a little sore.
Okay.
But like less tight. I don't know how to explain it.
Mm-hmm.
There.
Perfect. Yeah. So feel more connected to the ground,
Mhm.
that big toe.
Mm-hmm.
Yeah.
My left side. Like I feel the wobble. Like I feel like I'm still correcting it, but I feel it
Mm-hmm.
rather than just.
Yeah.
Like I kind of just knew it because of my shoes, and I can feel it if I've gone on a long hike. That ankle will be tired.
Mm-hmm.
So I knew I was kind of rolling out, but
Yeah.
Yeah, that's a big difference.
Yeah. Yeah, I'm gonna be a little in your head about the breathing and big toe for a while.
Yeah.
Cool. Let's go back next door. I'll write these down. So I gave 3, technically 4.
Can we sit here?
Yeah, I can see there. So, breathe embrace. So you're doing just 5 to 10 reps all day. Whenever this is kind of more of the lifestyle modification, whenever you think about breath in, just be like, oh, let me just do 5, cough, maintain that pressure as you breathe. Eventually, it'll be new normal. That's good, yeah. The easiest way to do it is laying on your back and sitting, standing, walking, running, exercise. The more complex the movement, the harder it is to activate. But eventually this will be a new normal. Great time to practice is at the gym, right? Doesn't matter what exercise you're doing. Like, I'm gonna do a bicep curl. Before I lift the weight from the ground, let me just, okay, cool, lift it. And again, eventually it just becomes a new normal. So then the quote unquote workout is gonna look like this. Again, lifestyle, you're going to start with dead bug, with taps. All of these, we're going to just say about 30 seconds. So we start with deep core, and glute, bridge, hold. Again, about 30 seconds. We're just looking for, we're giving the brain and muscles time to sit in a position and figure it out. And then the other one is a kettlebell pass. Kettlebell passes from the heel, lifted, lunge. We did a 15. I think that's probably a good work for you. 30 plus seconds. You start getting into foot strengthening. Don't send it, take it slow. Because I always say, like, if you do a ton of biceps and your arm is super sore the next day, you can kind of not use it.
Same with the feet.
Yeah. So can't take a day off using foot. So you're gonna go through this 3 to 5 sets. This could be a great addition or a warm-up. If you're already going to the gym 5 times a week, this could be a great warm-up before.
Okay.
Yeah. We start with the deep core, just to like get that active first. Glute bridge hold. It's more about getting the hip active and then getting that foot hip connection.
Okay.
So they get more complex. Week.
All right.
Cool. Questions on that?
No. This is awesome.
Good. I like it. That's
Thank
awesome. You got it.
Have you heard of the Postural Restoration Institute?
Yes, I have.
This is like I've been looking into some of this stuff and they talk about this a lot, but this makes a lot more sense, like what you did.
Okay.
It was the same stuff, but I could never figure it out.
I haven't really looked into what.
I've just looked with a couple people who kind of are certified through them, and like the way they have it, like it just never has clicked. So this was really helpful.
Oh, that's good.
Thank you.
Yeah, the way I typically work is like, one, like let's figure out what's actually going on. Like your biggest thing, deep core, and then that left foot hip connection. There's probably there is some shoulder blade. Your shoulder blades actually move pretty well. But you have to start with like
foundation.
Let's take time to like just find this, and then these build into looking more like human movement.
Yeah.
So, yeah, that's good.
Yeah. Can I come back?
Yeah.